Oh, what happened?
Oh my god, I have had a difficult brain surgery. Can't believe it took me so much time for that.
Another laparoscopic surgery case, huh? Well, how could it be difficult for you, an expert of it? I think I have a solution for this problem. An innovative technology lead. What do you think?
Do you mean by using robotic surgery?
Exactly. It's the 21st century now. Why don't we propose this idea to the board director of the hospital and bring this device to Vietnam?
Great!
Hello, the board director of the hospital. My name is Hao.
And I'm Yon.
Today, we will bring to you a breakthrough device which can generate a massive change in the improvement of Vietnam healthcare system, robotic surgery.
And particularly, the Da Vinci surgical system.
The surgical robot is a computer control device that programmed to aid the surgeons, enable them to carry out more complex tasks. For the history, in 1985, as robot, the first existing surgical robot was introduced, which was the base for the development of the Da Vinci surgical system. In 1997, it's become the first robot that's got the FDA approval.
So, for the advantages, the Da Vinci surgical system will allow doctors to perform complex procedures with a high precision, flexibility, and control rather than the conventional techniques, and therefore, by decreasing the invasion to the healthy surrounding areas, it will reduce the possibility of blood losing, pain, and even have the aesthetic values.
Besides, what about lack of tactile information when the surgeon cannot directly feel the pressure that this device pulls on the tissue?
So, for the lack of tactile information issue, according to research from the Shenyang Hospital in China, they solved this problem by using the data about the patient characteristic, also the interaction between the human soft tissue with the surgical instrument, and therefore they use this to decide the robot. And the robot also equipped with the safety and the reliability evaluation system.
So what about possible technical error? In 2017, a patient in Thai was reported to have been nicked during a surgery using the Da Vinci. This was not recovered until he died 2 days later. In case this situation happened, who will hold responsibility for this? It could also raise concern about ethical issues.
So it's a controversial issue. In theory, if the mistake was made by a surgeon, so the surgeon should take the responsibility. But if it got a technical error, the manufacturer will take the responsibility. But in fact, we can minimize the risk by checking the machine quality before the surgery and also warranting it.
I'm so excited. I wonder what the future can be.
Dear Thắng, it's 2021. You remember, in 2014, only one hospital in Vietnam was equipped with Da Vinci, but by the end of 2017, the figure had increased to 5, and now 10 leading hospitals with more than 1,200 successful cases. The outcome of Da Vinci is very promising. Perform complex surgeries that conventional surgeries cannot do, minimize dangerous complications, quick improvements, and reduce half the time of hospital stays. There were many positive feedbacks from patients and doctors.
Từ cái phòng mổ ra là nói thật là tôi cảm thấy rất khỏe. Về đến phòng cái là tôi bình thường, không đau đớn một tí nào.
Bởi vì cấu trúc đặc biệt của cái dụng cụ robot ấy, thì nó cho là cái dụng cụ đấy có thể tiếp cận được vào những cái vùng rất sâu, và với một cái bàn tay mở thì rất là khó.
Cái tư thế ngồi, bạn nhìn thấy tôi ngồi ngoài mổ rất là thoải mái và như là mình đang chơi game, nếu mà nói đúng là như thế.
Vietnamese people have gradually changed their opinions on robotic surgery, and the growth of Asia-Pacific surgical robots market shows an increase in patient needs. Vietnam is forecast to follow that trend too. Furthermore, the fifth generation of wireless technology increases the likelihood of performing robotic surgery without needing doctors to be present, thus breaking geographical barriers. Amazing, right? So excited to receive your response. Dear Team 3.